My name is Joanne Eveland. I'm a family physician, HIV specialist, and addiction specialist. Piloting a managed alcohol program really felt like a natural outgrowth of San Francisco's harm reduction policies for people who use alcohol. It really felt like a necessity for us in responding to this pandemic as we were finding ways to support people to maintain isolation. San Francisco has had many other innovative services for people who use alcohol. We have medical detox, we have a sobering center where intoxicated people can safely recover without having to go to the hospital. We have an addiction consultation service at Zuckerberg San Francisco General Hospital, where patients can be linked to medication-assisted treatment or rehabilitation. So we were doing a lot already in the community for people who drink alcohol. As we set up our isolation and quarantine sites, like many other cities, we were really looking how we could help people who couldn't safely isolate elsewhere. Quarantine is hard. People were with us from somewhere between 7 and 21 days usually. And particularly in the early stages of our pandemic, we were serving a high number of people with alcohol use disorders. And withdrawal from a lot of substances is really uncomfortable. Withdrawal from alcohol is potentially deadly. So the goal of our managed alcohol program was to help people both adhere to self-isolation, but also avoid life-threatening alcohol withdrawal syndromes. Any approaches we take in public health should really be evidence-based, and we should really look at making sure that we're free from stigma in how we're approaching the treatment of substance use disorders, which to me are really like treating any other chronic condition, similar to diabetes or HIV. These are chronic diseases that require usually some combination of medical therapy and lifestyle changes and a lot of support for people to do well over time. So we had a guest a few months ago in isolation quarantine. He'd been drinking a pint of vodka daily for over 30 years. Came in and had planned to continue drinking through our managed alcohol program, but we checked in with him every day. And then within a few days of being with us, he developed trust with his addiction medicine provider, who was one of our UCSF addiction medicine fellows working closely with this program. And he started to think about cutting down. So he agreed to initiate a medicine for treatment of alcohol use disorder and that decreases cravings to drink. And with that, through the course of his stay, he cut his consumption down to 2 drinks a day. And then after his quarantine period was complete, he made plans to follow up with his new addiction medicine provider to start on a long-acting injectable medicine. And his new goal at that point was sobriety. So again, people are pretty amazing when you actually listen to them and provide the resources to support their own healthy goals. I think we're still in the early parts of this pandemic and really trying to just get through as a city, and it's really hard. I think the only bright spot for me here is that maybe this virus has actually helped us remember that we really are all interconnected and that our own health and well-being is really intimately tied to the guy who sleeps in the doorway of my clinic or the guy standing next to me at the liquor store, and that to reduce our vulnerability as a society, we have to help the most vulnerable among us. I'm really proud to be in a city that stepped up and moved over 2,000 people into housing to decrease their vulnerability to COVID. I have patients who've been waiting for years for housing who are now indoors, which is wonderful.